Good morning, all. Today's topic is critical appraisal of literature and evidence-based dentistry. These are the learning outcomes. Introduction. Literature search generate numerous scientific articles. The overwhelming volume of results can vary in quality and reliability of the articles. Content of scientific articles should not be accepted at the face value, even from the most prestigious journals and well known authors. Health professionals must be assess scientific articles by conducting critical appraisal. Coming to definition, what is critical appraisal? The process of carefully and systematically examining research to judge its trustworthiness and its value and relevance in particular context. Process of systematically examining research evidence to assess its validity, result and relevance before using it to inform a decision. Objective. Why critical appraisal is essential? False conclusions drawn from poor quality and biased results of studies in published articles may lead to public health problems if applied to the population. To ascertain if there is a flaw that is serious enough to compromise the methodology, results, conclusion, generalizability, or applicability to dental practice. When to conduct critical appraisal? Evaluating the effectiveness, whether it is cost, benefit of health programs or clinical practice, implementing health policies and public health decision making, establishing new health programs or clinical practice, reviewing for proposal of grants. Critical appraisal is intended to enhance the healthcare professionals' skills to determine whether the evidence is true and relevant to clinical practice, helps to reduce the burden and allow one to focus on articles that are relevant to research question or practice. Benefit: it's a lifelong learning skills and it enables the critical thinking, helps in selective reading of journal articles. Critical appraisal checklist. For example, if the study design is randomized control trial, we have to use consult guidelines for critical appraisal of that randomized control trial study. For observation, it's STROBE. For the systematic review, it's PRISMA. For case reports, it's CARE. Like that, depending on the study design, you are going to use the checklist to critically appraise the article. Critical appraisal, how to do it? First and foremost thing is obtain the full text of the research article. Read the whole article. The article will be having articles will be stated in the following headings like abstract. After that there will be introduction, methodology, result, discussion, references. Some journals have some different specifications, so this order are may be changed, or some journals won't have a discussion or like conclusion they won't be having. They will conclude in the discussion only. Preferences of reading a paper. General method, like method A is, it's a speed reading. First you have to read the objectives, conclusions, abstract, literature review, title, method and result, and discussion. Method B, aims and objective, methodology, result, discussion, conclusion, introduction, title, abstract. Title of the paper. So what all things you have to look when you check the title? Does it relate to the topic you are searching? Does it contain important keywords? Does it mention where the study was done? Does it mention what type of study design was used? Does it mention what outcome it has studied? Coming to author of a paper. Who are the authors? What are the affiliations of these authors? Authors are expertise in the relevant study area and location of the institution. Who is the corresponding author? Coming to abstract. Abstracts can be structured or unstructured depending on requirements of the journal. Should have brief introduction, then summary of the methodology, summary of results, and discussion and conclusion. Length of the abstract depends on journal requirements. IMRAD format. IMRAD means introduction, methodology, results, and discussion. So, in the introduction, aims, main, and specific objectives, background of the problem, then literature review. Then, why was the study done? What clinical questions were addressed? Then, the type, is it review article, case report, or clinical trial? Are the aims and objectives clearly stated, or can they be better? Any omission of literature? So, these all things will be there in the introduction. Coming to methodology, is the study design is appropriate? Assess the inclusion and exclusion criteria. 5 W's and 1 H checklist. Why, what, where, when, whom, then how. These things should be explained in the methodology. And methodology won't be same for all the studies. For example, cross-sectional study have different methodology, case control have different, cohort have different, randomized control have different methodology. So you have to assess each methodology based on the checklist what we discussed in the earlier slide. So IMRAD format, that is results. How are the results represented? Are they consistent with the aims and objectives? Do diagrams and explanations match? Titles, label, and tables are matched? Is it true zero is used? Then comes to analysis. How are the results analyzed and interpreted? Any statement of null hypothesis? Choice of statistics identified and elaborate? Are underlying assumptions satisfied? Are results clinically and statistically significant? Any test done but not reported? Effect size versus p-value? Confidence intervals and power of test. These are some of the scientific words. You have to search the meaning like effect size, p-value, confidence interval. Coming to the discussion, what do the results mean? Strengths, limitations, weakness, generalizability, conclusions based on the empirical data derived from study are associated with the existing literature and the recommendations from the researchers. Outcome. What I have learned from the reading the scientific paper, to whom does this information apply? What causal conclusion may be drawn from this? How general are these conclusions? What previous studies does this one replicate? Are its results replicable? To what extent does it describe or bear on the real world? What major gaps remain in my knowledge? How can I fill them? What leads for future researchers does the paper give? Coming to critical evaluation. This consists of two parts. The first one is critical appraisal, the second is critical reflection. Critical evaluation is the process of validating or devalidating a study based on its merit and demerits. Critical reflection. Critical reflection is an integral step of critical evaluation and to follow soon after critical appraisal. It refers to the external validity of the study. Critical appraisal of study may find it to be highly internally valid. Evaluation will ask, so what? Can the results and conclusions be extrapolated to other population and other contexts? Can the conclusion be applied to routine practice? What is its utility of population at large? How significantly can it change our concepts, ideas, and nature of practice? What are the implications of economic level? So this is about critical reflection. So critical reflection comes with like whether it can be generalizable, what is the cost effectiveness, or can it be used in routine practice, whether it is have any public health significance like we can use for large scale, or what is the utility, whether it is a concept tilting like till now we have observed some hypothesis, but suddenly from this new research our hypothesis may change, that is called concept tilting. Summary: critical appraisal is a systematic process used to identify the strength and weakness of scientific articles. Critical appraisal of scientific articles is necessary skill for healthcare students. Students will be given individual and group assignment to review and approve scientific articles published in a journal. Coming to the next part of the class, that is evidence-based dentistry. Coming to the introduction, in our day-to-day life as a consumer, we take many decisions. Not all these decisions we take are based on information from consumer reports, authorized publication, or from the experimental results. Even dentistry is no exception to this, either in usage of dental materials, treatment modalities, teaching and research, etc. Each day, consciously or unconsciously, we take decisions regarding our patient's care to make clinical decisions almost instinctively. Good and sound dental practices relies not upon bits and pieces of selected evidence, but rather upon the collection of best available research evidences. Evidence-based dentistry, EBD, it is abbreviated. It is an approach to oral health care that requires judicious integration of systematic assessment of clinically relevant scientific evidence relating to the patient's oral and medical condition and history, with the dentist's clinical expertise and the patient's treatment needs and preferences. So, evidence based dentistry is like patient treatment needs, we have to keep it as we have to consider, then the evidence of whatever treatment we are planning, then our expertise. So, all together should give one treatment plan by taking all these criteria into consideration. Goals of evidence-based dentistry. Evidence-based dentistry has two main goals. That is best evidence research. Second is transfer of this in practical use. This involves four basic phases like asking the evidence, searching for the best evidence, reviewing and critically appraising the evidence, applying this information in a way to help the clinical practice. Stages in the process of evidence-based dentistry. Evidence-based dental process is based on the abilities and skills of the clinician. First is identifying the clinical problem, search for the evidence, from that evidence make a sense of the evidence. If evidence is not good, then discard. If evidence is good, then update. Then last phase is act on that evidence. Identify clinical problem, converting information into a question. The first step in evidence-based dentistry is asking a clear question about the clinical problem. The question must be relevant to the patient's problem and phrased in such a way that it will point you towards the relevant and accurate answers. Questions. The questions are often related to therapy, diagnosis, prognosis, or causation. Most often the original question is too broad, so narrowing it down involves using PICO format. What is PICO then? The basics of well-built questions have PICO format. Like first is patient problem, second is I stands for intervention, C stands for comparison, O stands for outcome. So coming to an example where P, patient with osseointegrated implant, intervention, who smoke, comparison, who don't smoke, Outcome: what is the proportion of implants survived after 10 years among smokers and non-smokers? So we have covered all the components of PICO, that is patients, intervention, comparison and outcome. So this is just an example. Search for evidence. After establishing question, the next stage is to search for evidence. Evidence can be derived from number of sources, like asking an expert, reading the textbook, finding the relevant article, search a database such as Medline, PubMed, etc., Cochrane. 12 tools for assessing evidence. Be skeptical. Always it should, like whatever search you got that this material is good, you should be skeptical, always doubtful, you should not accept it. Then don't trust biological plausibility, that is apparent validity. What level of controlled evidence is available? Did the cause precede the effect? Any betting on the horse after the race is over? There should be no betting. What is a clinical relevant pretrial hypothesis? What is effect size? Does that size is matters? Is there even one different explanation that works as well or better? Was the study properly randomized? When it to rely on non-randomized evidences, placebo effects, real or sham? Was there protection against conflict of interest? Hierarchy of the evidence. From the below, the in vitro research have less considered than animal research, then editorials, case reports, case controls, cohort study, then randomized control trials, systematic reviews and meta-analysis. So the top one is systematic review. From this, whatever conclusion are from the systematic reviews are widely used. Making sense of evidence. Once you have gathered your material, the next stage is to appraise it. In the previous section, we have discussed how to appraise an article and see if it makes contribution to good evidence about your problem. After you have appraised the material, you decide to discard it or keep it. Critical appraising the evidence. The evidence has to be critically appraised for its validity, impact and applicability. This involves ensuring that the sources of potential bias have been eliminated and appropriate statistical method have been used. The outcomes are appropriately summarized so that decisions can be made based on their clinical importance. Applying evidence-based dentistry to patient. One of the ways that validity of information is assessed in the extent to which it can be applied to patient care. However, certain specific points must be considered while applying certain types of information to patient care. These are considered below: diagnosis, prognosis, clinical material. Advantages of evidence-based dentistry. For the dentist, high quality care offered, greater confidence, good rapport with the patient, satisfaction of offering the best treatment, effective use of resource. For the patient, needs and preferences were valued, improved treatment, satisfaction of receiving best care, no need for second opinion, less chance of harm, and it saves the time. For the researchers, keeps the profession alive by testing new products, can apply research to community needs. So, paradigm shift in healthcare. Previously, that is traditional practice, like unknown basis of evidence was there, but in the evidence-based dentistry practice uses best evidence. In the traditional practice, limited incomplete appraisal of quality of evidence. But in evidence-based, systematically appraise of quality of evidence. Then in the traditional practice, it's subjective. Here it's in the evidence-based, it's objective. In the traditional practice, it was black and white conclusion. In the evidence-based, it is acceptance of levels of uncertainty. Traditional practice, age of expertise. It's in the evidence-based practice, it's age of science. The problems in are the barriers in introducing evidence-based dentistry. The first and foremost is amount of evidence. For example, if you put GIC into Google, how many articles of GIC will be open? There will be numerous. So amount of evidence is more, and we don't know which one to be considered. So we have to critically evaluate each thing, and we have to have our own conclusions. Then quality of the evidence, then dissemination of the evidence, then practice based on authority rather than evidence. Conclusion: the concept of evidence based dentistry with a view to keep with advances in dentistry, the importance of evidence for every branch of dentistry in teaching in order to orient the practitioners among the great amount of most actual scientific informations and to support clinical decisions is a well established in dentistry. The practice of evidence based dentistry is a process of lifelong self directed problem based learning which leads to the need for clinical important information about diagnosis, prognosis, therapy, and other clinical and healthcare issues.